Okay, good morning. We're going to have a continuation of the last video of our, review, all right? So tachycardia. Tachycardia is a heart rate that is greater than 100, greater than 100. Bradycardia would be a heart rate that is greater or less than 60. Sorry, not greater, less than 60, okay? Bradycardia. Pulse can be weak or irregular, okay? That's kind of down the line for you. Let's just get these baseline numbers down so we'll know what we're talking about just a little bit. Sites of measurement, radial pulse. Again, radial pulse is right here on your wrist, be it your radial. Okay, children are on the brachial artery, especially 0 to 1. 0 to 1 children are on your brachial artery, which will be right here between these two bones, okay? All right, apex, we'll get to that later, of the heart. We'll talk about that and apical later on, okay? All right, locate the pulse by pressing lightly with the index finger and the middle finger pads at the pulse site, okay? So you could go with these two fingers, your index and your middle finger, right here on the pulse, okay? You can do it on the opposite side, and you grab the back of the person's arm with your thumb, okay? Never use your thumb to take the pulse, okay? Never use your thumb to take a pulse, all right? Count the number of beats felt in 1 minute. Okay, so let's talk about this. We're not gonna sit there for a whole minute and count the beats, okay? We're gonna count in 15-second increments, all right? So we're gonna do 15 seconds and then multiply that times 4, okay? So 15 seconds and multiply that times 4, because how many seconds are there in a minute? 60, correct? All right, so if I have kind of a clock here, all right, and I divide it in half, I have 15, 15, 15, and 15, right? So I have 15 seconds. So if we count and we have 20 beats in 15 seconds, how many do we have in a minute? 20 times 4 is 80 beats per minute, okay? 80 beats per minute. That's how easy that is, guys, all right? That's how easy that is, all right? 15, 15, 15 makes 1 minute, all right? 20 seconds, 20 times 4, which is 1, 2, 3, 4, equals 80 beats per minute, 80 beats per minute, okay? All right. Let's move on. If irregular, may count beats for 30 seconds and multiply by 2. Okay? If it's an irregular, and we haven't gotten to that yet, but heart beats can be thready. They can be a lot of things, and sometimes you have to do 30 seconds just to kind of get more of an accurate count of how many beats there are in the minute. Okay? All right. We're going to come back to regular and irregular pulse, okay? Blood pressure machines, pulse oximeter, electronic devices. Blood pressure machines, which when you come here, I will have a blood pressure machine for you to use when you're doing blood pressure. That'll be part of your daily assessment when you come to class, all right? Pulse oximetry. Okay, we haven't talked about pulse oxes yet because that's not been part of my vital signs lecture. However, you will have a pulse ox here, and I will show you how to use it then. All right, your pulse ox numbers will go over here in just a minute. Okay, respiratory rate, indication of how well the body provides oxygen to tissues. Okay, check by watching, listening, and feeling movement. Okay, respiratory rate, you're going to sit there and watch a patient and see if they have labored breathing, if they're going up and down, if they're, there's a lot of things that they could be doing while they're breathing, okay, that would hinder that. Hence the reason why we wait for 15 minutes on the person to kind of calm down, lose the anxiety of being in a doctor's office or lose the anxiety of being in the ER or the hospital, and let them calm down, and then we take their vital signs, especially when it deals with the heart rate and the respiratory rate, okay, or the blood pressure, which inadvertently affects all of it, okay? One inhalation, one exhalation, one respiration. Okay. Normal respiratory rates, 0 to 1, 26 to 40, 6 to 11, 20 to 30. All right. We're not going to get that deep into it. Most of the time, if you're going to go into pediatrics, those numbers are really important for you to know for children, and especially when they're 0 to 1, those respiratory and respiration numbers. But right now, we're going to stick with the 16 to 20, because most of the time you'll be dealing with your classmates and those, and we're just trying to get you into a rhythm of assessing a patient. Okay, that's all. We're trying to get you in the rhythm of assessing a patient. Okay. Check respirations. Look, listen, and feel movement of air. Count with a stethoscope. Okay. Count for 1 full minute. Okay. We're not going to count for 1 full minute. We're going to count for. You answer that question. Okay. Irregularities, indication of possible diseases, hyperventilation, excessive rate and depth. Okay. Hyperventilation will be. That would be a person that is under really some type of anxiety or something like that, unless they have some type of respiratory problem. Okay. Dyspnea, difficult or painful breathing. Okay, that is dyspnea. This vocabulary is something that you will need to know. Okay. Tachypnea. Okay, rapid breathing. Hyperpnea. Okay, abnormally rapid or deep breathing. Hyperpnea. Irregularities. Rales, Cheyne-Stokes. We'll get to that later. That is going to be more on your, when you get ready to go to respiratory school, or you're getting ready to go to nursing school, or you're getting ready to go to medical school, and you are going, so we're going to speak that into existence, all right? So these are things we may go over if we get down that street, but these are really specific breath sounds, and I'm not necessarily interested in you knowing those right now, okay? Apnea. Now, apnea is one I'm interested in you knowing. Okay, apnea is the absence of breathing. If you want to talk about flat lines, flat line is an apnea. Okay, flat line is an apnea. The force at which blood is pumped against the walls of the arteries. Okay, now we're talking about blood pressure. The force at which the blood is pumped against the walls of the arteries. That is going to be your initial pressure, which is the top number, is your systolic. Okay. Your systolic. And your systolic should be what? Okay? 2 pressure measurements. Systolic, measure of pressure when leaving the ventricles. Okay? So when blood is leaving the heart, that is when you're going to, that's what's going to be your systolic. Okay? Diastolic is a measurement of pressure when the heart relaxes. That would be blood coming back to the heart. Okay? Systolic, leaving the heart to take nutrients, oxygen, and other things with the blood through the body that it uses. Diastolic when it comes back to the heart. Okay? We'll go into this more specifically later. Let's just get this down right now. Okay? Measurement of pressure when the heart relaxes. Minimum pressure exerted against the walls of the walls at all times. Okay? All right, let's talk about blood pressure just a minute. If you know anybody, your parents or your grandparents or anything that on blood pressure, make sure they take that blood pressure medicine daily. A lot of times, older people, they don't like to take it just because they're just tired of taking pills. During my stint of home care, which is a very long stint, when you take blood pressure, a lot of times those blood pressure readings will be high. And then you have to ask the patient, hey, Miss Smith, have you taken your blood pressure medicine today? And she might say, hey, I haven't taken it in the last 3 days because that may have been the last time you saw her. So when those blood pressure readings are high and you compare them to the normal blood pressure that you're getting before when she was taking, that should be your alarm, okay? That should be your alarm. 120/80 is our number, okay? Systolic pressure, contraction of the left ventricle, top or first number. Diastolic pressure, Okay, heart at rest, bottom or second number. Okay, remember, blood leaving the heart, blood coming back. Okay, blood coming back. All right, so hypertension, those things are going to be second. So we'll do that on the video coming up next. Remember, I'm going to upload these videos. I will put it in a link where you can find it. I think I'm going to upload them to YouTube. I have a channel called BizVid Marketplace. So let's see what I do. I'll let you know how I'm going to do that. But this is the Monday lecture. I hope you enjoyed Monday motivation. And please keep those things in mind that stay busy. Okay? The devil is busy at the same time. All right. Have a good day.